A woman wiped back to front instead of front to back. This is how her husband's nerves shut down. EN is a 44-year-old man presenting to the emergency room with diarrhea and severe muscle weakness. He tells the admitting nurse that he hasn't slept well for more than a month, and he's been so thirsty, but he can't even grab on to a glass of water. Ian's wife, Cupcake, was recently on vacation on an equatorial island. Her trip seemed to just have problems nonstop, starting from the time when she arrived at the airport. And when she was at the hotel after lunch one afternoon, she started having diarrhea like no other, and it just wouldn't go away. It ruined her trip because after that day, she had trouble eating and drinking anything. When she got home, her diarrhea didn't go away. Every day, she would feel crampy abdominal pain squeeze into her stomach, followed by a terrible movement out. She really thought that maybe her stomach just didn't agree well with the food that she ate on her trip, but at home with her husband, they would prepare some food together. Since she came home from this trip, she would often release air into the room that was so foul to Ian that he just couldn't handle it. For some meals, she would feel okay afterwards, but other times, there would be massive problems. One evening, Cupcake went to the bathroom. Typically, she'd wipe front to back, but because she had gone so many times that day, she wiped back to front instead. The area was so sore, but when she looked back at the toilet paper, she thought she saw something horrible. She wasn't sure what it was. It was like there might have been some small, darkly colored dots inside. It kind of looked like big bits of pepper, except she hadn't eaten any pepper recently. Later that night, Cupcake was with her husband. She hadn't showered, but neither of them had thought that anything was different from how they would normally do it. When they were done, they both went to sleep, and something terrible was going to happen. In the early morning, Ian woke up. He had to use the bathroom, and it was here where he had the worst movement of his life. He couldn't understand what was happening because he could feel his stomach quake and shake inside his abdomen. As the days passed, Ian would just have nonstop diarrhea, just like Cupcake did when she came home from the trip. He couldn't keep anything down, but then things started to get worse. A couple weeks after having dealt with this, Ian hadn't eaten well for a very long time. He had trouble sleeping. He couldn't think straight. He just didn't feel like himself, and things started to get worse. One day, while driving to work, and after having his now normal morning diarrhea, Ian had to stop on the side of the road. He had trouble grabbing onto the steering wheel because his hands felt weak. When he would walk around, he would feel like his legs were shaking. Every time he tried to stand up, it would get harder and harder, and when he was finally up, he'd feel dizzy. After several sleepless nights, Ian couldn't take it anymore as he brings himself to the hospital where we are now. At examination, Ian looked okay. When doctors looked at his mouth, they thought it appeared a little dry. His skin was giving some indications that he was dehydrated, and when they took a blood test, it did in fact confirm that Ian was dehydrated. But not only that, they found out that he has hypokalemia. Hypo meaning low. Kali, referring to potassium, or more formally kalium, is shown by its symbol on the periodic table of elements, and emia, meaning presence in blood. Low potassium presence in blood. Ian told the medical team about his nonstop diarrhea lasting several weeks by this point. He told them that he didn't know why it was happening because he hadn't traveled anywhere recently, and he hadn't eaten anything out of the ordinary. When the body has diarrhea, nutrients that should have been reabsorbed are wasted. That's why it's watery instead of the solid fecal matter that's supposed to be formed. A persistent, chronic diarrhea will incur a great amount of loss because every day the amount of potassium out of the body outpaces the amount of potassium in. But why was Ian having this diarrhea? In the hospital, the medical team waited for Ian's next movement. They collected a sample, and when they were able to look at it, they found Giardia duodenalis, a protozoan parasite that causes persistent infectious diarrhea. This isn't very common in the United States, so where did this come from? Infectious Giardia cysts come from contaminated food or water. In the United States, if someone has this from either of these routes, it's likely because they had traveled to another country. Doctors know that Ian hadn't been traveling, but when they asked if anyone in his household had been, suddenly everything made sense to him. Ian called Cupcake. She still had been sick all these weeks that Ian was sick. This didn't seem like a coincidence to them anymore. He told doctors about the trip that she had had and about her sickness during that trip that persisted all the way until today. It didn't seem like she could eat anything, and after a few days, it appeared that whatever it was, she had spread it to him. And when Cupcake came into the hospital, her stool sample was positive for Giardia. This made sense to her. Giardia cysts can live in the environment in places where it's endemic. These cysts contaminate food and water, or hands and surfaces, and when they get into the small intestines of humans, they release trophozoites, which are the active feeding stage that can multiply, and it's here where they cause problems. They disrupt normal nutrient absorption that would happen, and they cause bloating and cramping and all the abdominal problems that Ian and his wife experienced. As the parasites get to the colon, they become cysts, which get passed into the stool, and the cycle continues as they go and infect other humans. Ian's hypokalemia was due to gastrointestinal losses, and it was causing his muscle weakness. Electrolytes are used to send signals. The electro part of their name signifies that their electrical charge tells cells to do certain things. The most abundant positively charged electrolyte outside of cells is sodium, and the most abundant one inside cells is potassium. When a muscle contracts, it receives the signal from a nerve, and this causes sodium to rush into the cell to signal the start of the contraction. Because there's a huge influx of positive charge, the cell balances this by pumping potassium out. Calcium commits to the contraction, and when the contraction is done, potassium rushes back into the cell to signal for relaxation. If potassium isn't around to signal this relax, because Ian has hypokalemia, then his muscles will cramp. They can become weak because the correct signal to even start the contraction is disrupted. When the medical team did a test on the electrical activity of his nerves and muscles, they find that it was difficult to excite the muscles enough to contract, and that there was less connection of nerve to muscle because parts of his muscle have died. Ian's blood test had noted that he had other nutrient deficiencies. He had low levels of magnesium, which worsens hypokalemia, and low levels of zinc, copper, vitamin B12, and vitamin A. Although because he was an adult and nutrients can have significant stores in the body for some time, he wasn't symptomatic of these deficiencies. But this is why Giardia is a public health problem in places where it's endemic. Not everyone who gets Giardia is an adult. Children who get infected are famously known to have stunted growth and delayed development because the parasite sits in their small bowel and prevents them from absorbing the nutrients that they need from food. This has lifelong impact on the person and never really goes away, even when the parasite is eventually eliminated from their body. Other accounts have demonstrated that Giardia cysts can enter into the pancreas, and they've been found inside pancreatic tumors. It's highly unlikely that they cause the tumor, but rather we know that they can migrate within the GI tract, with the pancreas being one possible destination because it's happened without a tumor present. Cupcake, having gotten cysts from her trip, had gotten them into places where Ian had oral to fecal contact, and the Giardia spread to him. The nutrient malabsorption due to the excessive, chronic, infectious diarrhea is the most important consequence of this kind of infection. But the treatment is relatively simple. One dose of tinidazole, an antiprotozoal medicine that should eliminate all Giardia parasite. Doctors told both of them that by day 7, their diarrhea and all other related symptoms should go away. Ian was given all the nutrients and vitamins that he was deficient in for some time in the hospital. When he was discharged, he was noted to have some improvement in muscle strength, and at follow-up months later, Ian and Cupcake were noted to have returned to normal health as they were able to make a full recovery. One way to prevent Giardia that can be in your control is to wash your hands very often, especially before you eat. Thanks so much for watching. Take care of yourself and be well.